It was 1 week ago that the twin disasters hit Japan, the earthquake and tsunami, triggering the third crisis, the threat of a nuclear meltdown. And as Japan continues to struggle and the world worries, the death toll is still climbing, now at nearly 7,000. People around the world a week ago watched in disbelief as the images of utter devastation streamed into their living rooms. The quake, which has now been upgraded to a magnitude 9.0, triggered a massive tsunami that wiped out villages right off the map. And then a week later, search teams find more bodies as they continue to comb through the rubble. Some 10,000 people in Japan are still missing. And the efforts to regain control of that nuclear power plant are intensifying. Today, health officials in BC were inundated with calls following reports of minuscule amounts of radiation from Japan being detected in California. A News reporter Stephen Andrew begins our coverage.
As the nuclear crisis grows in Japan, there are signs the level of anxiety is growing on Vancouver Island. The radioactive plume released from the plant last week reached Southern California today, prompting callers to inundate the BC hotline. But officials say we shouldn't be worried. The readings are about 1 billion times beneath the levels that would be a threat to health.
We are concerned about it. We want to monitor it. We want to be able to tell the public what is actually happening. But even our worst case scenario suggests that for us, as opposed to the Japanese, it's not a cause for concern.
Dr. Kendall says the average radiation in downtown Victoria today is about 2 millisieverts. If you live in the interior of British Columbia, you're probably getting about 5 to 7 millisieverts. And to show you how low that is, when you receive a CAT scan, you're getting 15 sieverts of radiation.
In fact, you will probably get more radiation from a cup of coffee than what's in the air from Japan. But Canada is watching the radiation levels closely. One permanent monitoring unit is stationed on Vancouver Island in Sydney. The Provincial Health Officer says the unit contributes to daily readings, but the province is planning to add additional monitoring stations.
We're sort of actively pursuing maybe deploying some more portable radiation monitoring for areas perhaps in the interior or on the coast.
Kendall says the units will enhance radiation reporting, but he stresses the fallout from Japan is low. And if you're thinking of escaping the radiation in BC by heading east, the doctor says you would probably expose yourself to much more radiation on the flight to Toronto. In Victoria, Stephen Andrew, A News.